Thank you. Hello there, my name is Femi Akonde, and you're watching the hottest debate show on TV, The Big Issue. Thank you. Well, industrial actions are not new to the Nigerian labor workforce. The most frightening is when workers in the health sector down tools. Recently, the Joint Health Sector Unions, that's JOHESU, embarked on an industrial action to press home its demands, bordering on improved healthcare facilities and welfare of its members. This action has literally brought the health sector to its knees. Health workers are getting criticism from all quarters over their decision to stop saving lives until the government grants its demands. This is a matter of life and death. But despite the seeming infamy of the health sector industrial action, some people still believe this is a means to an end. The striking health workers have even asked Nigerians to blame the federal government for doing nothing to stop a shutdown of the health sector. They demand a better salary package and also seek an improvement in public health care. Is this too much to ask? So today we ask, is the health workers' strike a means to an end? Well, I assure you it will be a healthy debate. Don't go anywhere. This is The Big Issue. Welcome back. Is the health workers' strike a means to an end? Well, to debate this topic, we have Comrade Adegoke Kehinde. Let's welcome Comrade Adegoke Kehinde. Comrade, thank you. Please take this side of the podium. Well, Comrade Adegoke Kehinde is a trustee of the Health Workers Union and also an SSA. What does the SSA mean?
Okay, it's actually SATRI, the Senior Staff Association of University, Teaching Hospital, Research Institute, and Associated Institutions.
That's a lot. Thank you. Well,
thank you.
Comrade Adegoke Kehinde is here to justify why industrial actions remain the only viable means to salvaging a decaying sector. Thank you for coming, sir. A round of applause for him once again.
Thank you. Thank you.
Well, ladies and gentlemen, on the flip side, I have Cyril Abaku. Let's welcome Cyril Abaku.
Thank you.
Welcome, Cyril. Cyril Abaku is a researcher and, of course, a notable public affairs analyst. And Cyril Abaku is here to tell us why he feels the industrial action in the health sector is not a means to an end. Let's welcome Cyril once again.
You're welcome.
Cyril, is it that you don't agree with the demands advanced by the Health Workers Union, like JOHESU?
Well, I think that in the first instance, demands are going to be made as far as you have workers and you have unions. But I think that every demand is born out of a circumstance and born out of a milieu. I think that when I hear health workers say that they want equal pay with doctors, when I hear health workers say that even if there is looming Ebola, they could care less.
Wow.
When I hear health workers say that they've taken oaths like the Nightingale Pledge and so on, and yet those who have been trained to guarantee the enforcement of the right to life, which is the primary and most important human right in the world, they say that they can choose to let that right slide away for the sake of pay. I think there's a big question mark on that.
Okay. Well, these are allegations. How would you respond to that? Well, health workers, you have looked away. You have decided to turn a blind eye to the Ebola crisis that we have in Africa that could even creep into Nigeria, and your workers decided to down tools.
Well, it's a pity. The situation we have found ourselves in Nigeria, by the time I finish making my point here today, you will realize that, of course, we are human beings too, and we are liable to fall sick. Anybody can be a patient at any time. We also fall sick. But the situation we have found ourselves in the Nigerian health sector, the operation, the management, and the system has been so hard and so terrible that we have to take our destiny in our hand. And I'm telling you something, it's when we are in a good frame of mind that we can render effective health services. So we need to let the whole world know. You see, occasion of today reminds me of when I was in post-primary school and a friend was invited for a debate like this, and she started with a Latin saying, and I quote, "Jimbo, Jimbo, Jimbo Fiesta, Jumbo Ulabalu," which means I have not come to exhibit grammar, but I have come to make points. And when I make point, I mean the big issue. When I make point, I mean to tell you that in Nigeria health sector, the #1 point I will give you today, that in Nigeria health sector, there has been geometric destruction of Nigeria health system by doctors in the name of international best practices.
By doctors?
Yes.
That again is another allegation.
Yeah.
Can you prove it?
Yeah. You see, anytime we have issues, medical doctors are always there to tell the whole world about international best practices. And I'm telling you, the current Director General of WHO, that is World Health Organization, the body that defines standard in the health sector, that body, as it is today, is managed by Tedros, Dr. Tedros, who is not a medical doctor, and the World Health Organization is doing very well. Yeah. You talk of, go to Germany, the health minister in Germany is a banker. Go to US,
the health minister in Germany is a banker.
Yes.
A square peg in a round hole.
In India, is a lawyer. You talk of UK, the person in charge in UK read social sciences. Now tell me.
In Nigeria, Dr. Isaac Professor Isaac Adewale.
And the truth is that for the past 33 years, since 1985, Decree 10 of 1985 made doctors to be in charge of health system in Nigeria. And since then, health system in Nigeria has been going through deterioration, rapid deterioration. So for the past 33 years, doctors in Nigeria have succeeded in destroying the health system because they have made the system unbearable for other professionals.
Who should be in charge? The
truth is that there are health managers. There are people. Health management is a profession of its own. And go to developed society, places that, like in UK, where our president normally go for his health challenge, they are being managed by health professionals. Hospitals are not doctors. Are you not sure doctors. And I mean, the information is there all over in the public domain. Just mention any country. I mean, the technology has made it so easy. You can Google different countries. You will see they are managed by professional health managers. And even their ministers are not doctors either. Some of them study social sciences, some study banking, some law, some philosophy, some politics. And what that is telling us is that the best person, technocrat with managerial know-how, should be the one to manage the health system, not medical doctors. Every professional in the health system should face their professional practice and lead management for professional managers, technocrats, to manage the system. Everybody should face what they have been trained to do.
Cyril, it's like the world of the doctors against the other health workers who in the Nigerian sector now are like support staff, like support the work of the doctors. Now, someone said to become a medical doctor, you need 297 weeks of course, practice, training, and all that, which is required to become a doctor, while others put in an average of 148. Come on. Like, do you still agree with the health workers, like Johesu, if you look at their demands, they want to be on the same level with the doctors. Do you agree with them? It is not like, have they really paid their dues to deserve some accolades?
I think that for us to properly situate that question and give it an answer, we need to cast our minds back to what it means for an average Nigerian to come in contact with health or healthcare delivery. You go to a hospital or a clinic, there's a doctor, okay, sure, who consults. There are nurses, perhaps there's a laboratory and so, there's a lab scientist and so on. I think over time, there's concern that people who are not doctors, the other healthcare workers, now feel that they've been turned into errand boys and errand girls. So there's an ego war. There's an ego fight. It's petty. It's less than best. It is not bringing about excellence. But that we will sacrifice morality, the morality that commands the need for us to carry out our functions as nurses and as laboratory scientists, which is primarily about saving of lives, to keep it aside and bring up, let's say, 10-point, 5-point, 50-point agenda and say, the health sector is going down, we don't have enough tools to work. What they're really after is not the improvement of the health sector. They want to rub shoulders with the doctors. They want, you see, please hold on. You will see something. If you look at all the professions, people are getting increasingly worried. Perhaps one day I'm going to wake up and say, I should be addressed as journalist Cyril Abaku, because I have gone to school and I'm a journalist and I must be given a title. That trend is growing. You see, the idea of he's a doctor and so should be called Dr. So and so and so. It is difficult for them. You can either be a doctor by medical qualification or by academic qualification. I bet you that even if as a nurse, you read up to the point where you have a PhD, you will earn something reasonable within the rank of a PhD earner, one, and number two, you will be called Dr. So and so and so, PhD in nursing. But you see, there is, because we've been staying in the same building, and the doctor keeps on saying, nurse, bring the folder. Nurse, take the patient to the ward. Scientists, I need the result of the test. And because maybe they are always telling them, do this and do that, they are saying, but hold on. How long are we going to be slaving for the doctors? This is not a war to put the Nigerian health sector on track. It is not a war for better working conditions. It is a war to be equal with doctors. If you want the health sector to work, you don't need equal pay with doctors to make the health sector work. I see no reason why.
I'm sure the issue is that we have to take our destiny in our hand. If we don't address this issue and make Nigeria to see clearly that the health system in Nigeria is going down drastically with the way the doctors are managing, the way they are managing it, they always claim international best practice. I've told you earlier that international best practice requires the best hand to manage the system, not necessarily a doctor. And the challenge is that if we don't fix it now, the big issue is if we don't fix the nonsense, the destruction, the decadence that is happening in the health sector, I'm telling you, what is happening is that brain drain is happening to other health professionals. By the day, our colleagues are leaving for UK, US, Canada, Saudi Arabia, Canada, Australia, New Zealand. Why? Doctors have made the environment unbearable for other professionals and other workers. They have made it so hot that many of our people are leaving. And the challenge is that even this action that is on now, government is willing. But unfortunately, those who are representing government, I'm talking of the Minister of Health and his counterpart in Labor and Employment, Dr. Ngige.
Chris Ngige and Isaac
They are both collaborating together to work out the script of Nigerian Medical Association. And the script is that
are you sure about that?
Of course, we know. 2010, 2011, 2012, they were writing all manners of things on the pages of newspaper. And what they were trying to do is to paint us black, to call a dog a bad name so as to kill it and to hang it. And after that, all they are now trying to do is to tell government that they should privatize the services of other healthcare.
One question is strike
when you say
a means to an end. This industrial action,
by the time
is that the only way to go?
The only language we have seen in Nigeria, practically, that the only language Nigeria government understand is strike.
Because they find this means of agitation repulsive to them, with due respect. That is one. Number two is the fact that many times when Nigerian patients go to the hospitals, they have very bad experiences, not with the doctors. And this is with apology to people who are doing their jobs well as nurses. Please hold on.
Doctors.
Let me
Nigerian doctor will not even let you talk. You are supposed to be free to know what you are doing.
I am not letting you talk. I am not letting you talk. How are you better?
Doctor will not even let
I am saying, ladies and gentlemen, please. I am saying here.
You are supposed to know what
I am saying here.
Let's let him talk. It's going to get to a point, and we call that segment "Fire for Fire." That time you can get at each other's throats.
I am saying here, and for a fact, that after they consult with doctors, not that they are saints, but Nigerians who go to hospitals, they meet nurses, they meet people in the laboratories and so on, they mostly don't find motivated to go back. Yeah. They come back with very bad stories. That is one. Number two is the fact that you are apologizing to the public. By the indices, Nigerians are sick. A sick public cannot listen to you. A dying public cannot listen to you.
Even a sick
job is
a sick health worker cannot deliver effective health service.
Your job.
A health worker that has been ganged up in a system cannot deliver effective service. We must fight this now and deliver the system.
Between a sick health worker and the sick public,
my friend,
because if they will be healthy,
you need the sick health worker
to still treat himself and treat the public.
Well, it's time for us to take a quick break, and at this point, it's time for the Fire for Fire segment, but that will come to you after the break. You're still watching The Big Issue. The Big Issue. Well, it's time for the Fire for Fire segment. This segment, of course, as it sounds, it's really hot. Gentlemen, in this segment, of course, you're free to puncture each other's argument. It's a free-for-all between both of you. Puncture each other's argument, but of course, we also encourage fair play so that it doesn't degenerate into noise. If you're making a point, try and listen. Of course, if you're trying to interject him and maybe he's not stopping, just try and allow him make his point so that you take it up from there, so that it doesn't get into a state where we don't hear each other and then the message will be lost. It's a Fire for Fire, and also mind your language. And it's not a boxing ring. You're free to ask him a question. You're also free to ask him a question, puncture each other's argument. So the ball is in your court. Fire.
Yeah, my friend, I know you have tried to talk about equality. That is the propaganda of enemy, the Minister of Health, the Minister of Labor. At any time.
When you say NMA, what is NMA?
Nigerian Medical Association.
The Nigerian Medical Association. Let's call it spade a spade.
Where the Minister of Health and the Minister of Labor and Employment belong. The propaganda they be issuing to the public. And I want you to listen well so that you'll be well educated, so that you will not be misinformed about their propaganda. What we are asking for is not equality. What we are asking for is fair play. If you look at in UK, when a radiographer starts practice as an intern, it starts with £23. And a doctor, a house officer, start with £26. I mean, is that not fair play?
Fair play.
Is that not fair play? Unlike in Nigeria, an intern in Nigeria, a JOSU member will start with an average of less than 80,000. While a medical intern will start with over 300,000. Is that fair? No. Is 1 year equivalent to more than 3 times? No. My brother, be well informed. Don't allow this propaganda to mislead you. You see, government will have acceded to our plea all this while. But the challenge is that these people have gone to sign an agreement. I don't know how an employee will sign an agreement with employer in the absence of another employee on issues that affect the third employee. I mean the third party. Is it done anywhere? No. Is that principle of fair play? Is that principle of fairness? No. I'm telling you, each time government want to attend to us, Nigerian Medical Association, they are always there with the Minister of Doctor, who's supposed to be Minister of Health. He is just taking care of his people.
All right, so let's try and balance the stage.
Okay. I'm just trying to let him know. I'm giving him the accurate information because the next thing you will hear from Nigerian doctor, the minister, is the blueprint of Nigerian Medical Association. They will talk about privatization of the services of other health professionals and workers. I'm telling you, Nigerian privatization, they talk about PPP. That's a public-private partnership. But in Nigeria, the PPP is 4 Ps. And the 4 P, the first P is the most important factor to them. And I call it personal, private, public partnership. Most of these doctors go and check their account. When they bring in anything, any service into the system, maybe they bring investors to bring equipment, we will work like monkey they work, babu they shop.
You say PPP, 4 Ps, right?
Yes.
In your opinion.
And the most important one to them is the first one, which is the personal interest.
I wonder why we invest so much time and labor so hard to explain jealousy with such a long sentence.
It's a pity.
When it can be, when our explanation can be expressed in a single sentence. I am still asking why this strike is not a crime against humanity. That lives are being lost. That Ebola is at the gate of the country. That people are pleading and saying, look, in your calling, if you are a teacher, if you are a health worker, as far as your service is humanitarian, human lives come first. I don't see why a doctor was on strike 4 years ago. She died saving Nigeria from Ebola. My father was a soldier. After the Nigerian Civil War in 1970, he set up an infirmary.
Even Stevie Wonder could see.
He has seen death.
What we are talking about.
He has seen destruction, and he said that if anybody should live for anything in life, it is to save lives. He was talented, he was charismatic, he was gifted, he was brilliant. But he said, with all these skills I have, the best way I can touch my fellow men is to be of service to them. And in a small corner of this country,
we are doing.
He set up a practice and was teaching people. Today, they know him as a medical savior of people, not as a millionaire. I think that in a developing nation like Nigeria,
we are doing.
If you are a teacher, you are a health worker, whatever, are the doctors happy with what they are earning? No, because in basic economics we are taught that man's needs are insatiable. If you tell me today, please hold on, the enemy. Look, let's be frank with ourselves. NUT, NMA, all these bodies, they have been in Nigeria from time, like they've been there for a long time. Okay. I don't know when JOSU was formed. But you see, when you're a toddler union, when you're a babe, when you're a suckling, take breast milk. With time, you will grow and learn to walk. But you see, to shut down the entire health sector,
most importantly, when the nation is heading into a major health crisis,
unfortunately,
it's a crime against human conscience. It's a crime against
unfortunately, my fellow debater here seems not to understand, seems not to see
that you hear government say that they are going to ban unionism.
I hope that the NLC and the TUC
and the ULC or whatever they are affiliated to will sit up and make sure that you see the right to embark on industrial action is not abused by the
your comments or your opinion is unfortunate. Go ahead.
Unfortunately, we gave notices. What the labor law requires from us is 15 days as essential service provider.
But this is not the first time you're giving such notice and embarking on strike.
We gave 21 days notice. We later on gave another 30 working days. When I say 30 working days, minus weekend, that is 42 days notice practically. And I don't know whether those that Buhari put there to manage the system, whether they were not hearing. And I'm telling you, unfortunately, those who are supposed to represent government in Ministry of Health and in Ministry of Labor, we are supposed to be arbitration, they are both working together in collaboration, creating frustration on other health professionals. And let me tell you something, it is only when you have good environment, when you have ambient environment, we have team relationship.
Can I ask you a question?
Let me ask you a question before you ask. Do you realize, now I'll let you know something. Do you realize that in today's health sector, there are 9 judgments in favor of GESU members, 7 for medical lab scientists, and 1 for the nurses, and another 1 for the general GESU members. Do you know that in Nigeria of today, the Minister of Health, despite all those judgments, has refused to implement judgment? If you are going to have fair play, if you are going to have democracy to thrive, if you are going to have teamwork, because according to WHO standard, health services is a teamwork. No single profession can deliver health service effectively. And do you know that the current Minister of Health and Labor have been frustrating implementation of industrial court in Nigeria, National Industrial Court? Do you know that they have been frustrating 9 National Industrial Court, and that is the court of competent jurisdiction to address anything that has to do with labor dispute.
I have a question too.
Okay, my brother.
Okay, now the health sector has been crippled because of GESU's strike. I understand GESU also plays a pivotal role in that sector. Now, you go to the primary health care centers, women can no longer have a safe delivery. Injured people injured, maybe let's say, for instance, in road accidents and the rest, cannot get good treatment. Lives are being lost. As a member of GESU, how do you feel? That's my question. How do you feel?
But doctors...
How do you feel?
I've told you it's a pity.
Doctors, of course, doctors are not on strike. But doctors cannot do it alone.
The earlier they know that, the earlier those who are supporting knows that they cannot do it alone, the better for them. Because the truth is that they keep talking about international best practices, but what has their own international best practice in Nigeria led us into?
Femi,
nothing. In fact, what we have seen is degradation of Nigeria health system. Honestly, the authority need to listen to us, because the big issue about this action is to let the whole world know that the atmosphere in the health sector is not ambient. The people who are managing it are making it difficult for other workers and other professionals. That's why many of them are leaving this country. They are leaving Nigeria.
Cyril, they gave, he said 21 days ultimatum.
Another 42 days.
Another 42 days. Come on. Why would you blame them? They have their demands. And of course, government should have invited them to a round table for dialogue.
You know, I have read reports and counter-reports. If I'm right, correct me if I'm wrong.
Okay.
I suppose you have had agreements with government in the past.
Yes.
Good. And I've also read reports where government was supposed to have claimed that there was no report, that they had no agreement with them. But that is fine. No, please, hold on.
Lies.
You see,
propaganda.
Either in 1983 or 85,
either during the Buhari or Babangida coups, one of them. I think it was General Abacha that read the coup speech, and then he said that our hospitals had become mere consulting centers. When we talk about degradation...
In terms of infrastructure.
Please hold on.
Okay.
The most important element in any value system, in any sector of the economy, is the human element.
Of course.
If Joesu can assist us in redirecting the orientation of their members in terms of service delivery, it will save Nigeria's health sector better and greater than this fight to be called with doctors. That is one. Number two.
You are missing.
Please hold on.
This man is blind.
Number
please
two.
Tell him to open his eyes.
Number two is the fact that when you go to a hospital, when files go missing unnecessarily, who are doing these things? Let me put it on record today that the Nigerian health sector, when they go on strike and when they don't go on strike, it is crippled. Just that it is only crippled in degrees.
Those who are managing it, they are not trained managers. They are not. Let the real professionals manage their sector.
At least he's confessing now. He's confessing now. If we want
hospital managers, let them manage the system.
If you want
doctors are trained to care for patients. Let managers manage the system. Let all of us let us.
Doctors are trained to care for patients. I'm also trained to care for my audience. So we'll take a quick break at this point. I want to return to the time for members of the audience to make their contributions, ask questions, and of course, weigh in on this very controversial subject matter. You're still watching The Big Issue. Welcome back. Welcome. It's getting really hot in here. And of course, it is time for members of the audience to weigh in on this hot subject matter. Is the health workers' industrial action a means to an end? And of course, our first question is from Kemi Lawal.
This is the big
issue. I like that.
I have a question, and the question goes thus.
Who is your question directed at?
Mr. Cyril. An MBBS holder, who is a doctor, spent 6 years in the university. A pharmacist, a medical lab scientist, who are Joesu members, they spend 5 years in the university. And point of entry into the civil service. These people now come in. The Joesu member comes in at level 8 or 9. And the MBBS holder comes in at level 12.
When you say MPBS, for the benefit of those that don't know the meaning, please.
That's the Bachelor of Medicine, Bachelor of Science. That's for the doctors.
Yeah, sure.
Now, 1 year difference of our study in the university, is it equivalent to 12 years of practice? I will need to spend 12 years in the civil service to get to their own point of entry.
Is that fair?
Which is not fair in my own judgment, but you should be able to tell me whether I am right or wrong. Okay. Don't forget, the curriculum of each profession is being assessed by the Nigerian Universities Commission, which, if it is not enough for you to spend 5 years, it will not be approved. So is 1 year difference in university years equivalent to 12 years of civil service practice?
I wonder.
Is that your question?
That's question number one. Secondly, he talked about issue of court judgments. if our courts are being disobeyed, then where else do you think we should run to for our grievances?
I wonder.
Because if you have a grievance, I believe that both parties are being represented in the court. So when they are represented by a lawyer, before the judge can pronounce a judgment, that means he is convinced beyond reasonable doubt and existing laws. When judgments are now being passed and they are being flouted, being disobeyed, is that not impunity?
I wonder, please, let me tell you.
You said Nigerians are dying. I watched the TV severally, and the NMA says these people are not important, that the hospitals are running, that they are working. So why are Nigerians dying?
I wonder.
And fortunately, you said whether the JOSU is on strike or not, whether doctors are on strike or not, they are dying. Have you forgotten that even the Nigeria health system needs to be audited? The management itself needs to be queried. Because nobody is accountable, nobody is being punished for every life that is lost.
Executive
So
recklessness.
definitely, I think we need to still change our management style. During President Obasanjo's time, if you remember, during President Obasanjo's time, he did not appoint a medical doctor as a Minister for Health. Professor Eyitayo Lambo was not even JOSU member. He was a strict health administrator, and we had no issues. Even during the Baby Eniola saga.
So is the problem with appointing doctors as ministers of health?
The issue that we have, that I have seen so far, is because nobody is being punished. Nobody is being queried for lives that are lost. If you are a minister for health, if you are a chief medical director, and you know that for every life that is lost, you have to explain, you have to be accountable for it, then you will know that this is something that we need to take good care of.
Let us begin by saying, first of all, that nursing, laboratory, tech science, law, and law, mass communication, and so on, no particular field of study has the same curriculum or is designed to run the same way. But it's fine that nurses and people, JOSU and NMA, find themselves working together in the same sector. Now, you could have, I don't know whether you are a lab scientist or you're a nurse, but whichever you are, you could have well studied in Germany and be practicing there. It could have been a different issue. Now, the issue is that the Nigerian employer, for whatever reason, has employed you the way he has employed you. But that is an injustice. I do not know. There must be a line between the employer, the laws of employment on the one hand, and your qualification as a medical, as a health worker, and the rules and principles and morality guiding health practice. I am not aware if there is any provision in the Nightingale pledge or any other pledge that you take that you will see somebody dying, on the verge of dying, or just about to die, and you will say because of X, Y, Z reason, the right to life must have terms and conditions. I am not aware of that.
One of the oaths of the pharmacist, I will consider the welfare of humanity and relief of human suffering my primary concerns.
So I am not aware if there's any provision in your professional qualification and all the things you want to abide by, that the right for you to enforce the right to life, knowing that even when you're sick and someone else is sick, for there to be health, you have to do something to enforce health to come, you know, for the person to recover. That right, the person can enjoy it based on terms and conditions. I am not aware. That is one. Your second question, you have lawyers. And I know that where there's a court judgment and perhaps people don't want to take it up and so on, you can enforce the right of mandamus. I'm not a lawyer myself, but please, JOSU, you know, you can go back and talk to lawyers on that score. Lastly, that
You know, the enemy, even as I am, there is the NUJ. But I do not think that they will reflect my personal opinion all the time. And that is why that a particular dispensation of the enemy or a particular state branch of the enemy used derogatory language to describe Johesu does not mean that all the doctors put together in Nigeria have said that people in Johesu are unimportant. I reject that.
Hold on. NMA in Ondo State described the demand of the striking Joint Health Sector Union as frivolous, absurd, and not obtainable anywhere in the world. They also went further to say that the strike is not in the interest of Nigeria. Yeah. Respond to that quickly.
Yeah, and I've told you time without number that the strike is in the interest of Nigerians. Let me tell you something. Jesus Christ, who is a perfect master, he told us something, a principle. When you are slapped on the right side, what did he say?
Turn the left. Thank you.
Then when you are slapped on the left side, he said, you use your discretion.
My name is Pharmacist Kingsley Okunife. I'm a member of Johesu. Okay? Nobody is asking for parity with doctors. Please stop misinforming the public.
Yes, please.
We have never asked for parity with doctors.
What are you asking for?
The doctor starts on level 12. I start on level 9. Am I saying I want to start on level 12? No. That's not what we're saying. What we're saying is that the federal government, the principle of a separate salary structure for doctors and a separate salary structure for Johesu members, the principle is that they have COMMES, Consolidated Medical Salary Structure for Doctors. We have COMHES. So, and the principle behind that separate structure, because ab initio, disparity is automatic because of the entry points. What has happened is that in 3 times, 2014 January, 2017 September, and the salary of COMHES has been adjusted.
But COMHES has remained the same?
3 good times. And it took government 2 weeks to implement it.
When we embark on industrial action,
I love that.
At a critical moment,
it has to be addressed. I love that.
At a critical moment, when the nation's borders are porous, and we are being faced with the likelihood of an Ebola incursion, it goes against the grain of morality.
Are you sure?
Every legal right, every worker has to go on strike. Legality draws inspiration from morality. And where it is immoral to go on strike at a particular time, no law should be seen to be right or just in backing that action, because the consequence will be collateral. And when it comes, it won't affect only health workers. It will affect the soul of Nigeria.
We the people.
Yeah, so why should we close our eyes and fold our arms to such inhumanity?
Thank you.
My name is Adamson.
Thank you.
Big issue.
Big.
Now, my question is a comment now. What I think is that the health sector is actually at the state of total collapse. And it's just because we have the ministers, let me say the government generally, that they are not sensitive to the plight of Nigerians. If they know that Nigerians are dying, and they know these people are making demand, what are the demands? Come, let's look at it. People are dying. We have, let's say, the doctors, like other Johesu members, they are also trained to treat patients, not to actually administrate. They are not an administrator. They are not business administrators, actually. So let the government, federal government, President Muhammad Buhari, let them change. Let there be Minister of Health that is neutral. Let there be all the CMDs, let them be neutral. Let us have administrators. See, this issue we are looking at it's going to be more than this. I'm not a prophet of doom. But now, the doctors, they are also threatening to go on strike. If they go on strike, by the time they resume, what happened to Johesu? They go back on strike until when we have neutral body who manages hence our affairs.
Noel Woodruff is the president of Congress WBN. I want to quote his statement. He said, if your process does not validate your destination, then you need reformation. The process of health sector in Nigeria does not validate our destination or providing effective healthcare service. So I'm using this medium to tell President Buhari the whole health system in Nigeria needs reformation. He should address holistically. He has said it. We can agree on that point, that Nigeria sector needs holistic reformation. The Ministry of Health needs holistic reformation. That is the only way we can arrive at our dream destiny. But if we continue this way, we are going to end up in another place, which may not be good for us.
When Bill Gates visited, he knocked the federal government for failing to invest in the people, and he mentioned critical sectors, education and health. Don't you think these people, and when I say this, I mean Juhesu, don't you think their agitation and, of course, this industrial action is in good stead?
Now, the issue is this. Assuming that there was a national health emergency, will Juhesu put Nigeria ahead of their pockets? Yes. One.
Is that question for me or for the public?
So this is a question that we all have to answer.
Is it for me or for the public?
But the fact is that as it stands now, they are having very bad PR, public relations. I think it will be fine if we see them enough that they are putting the cause of the Nigerian people ahead of themselves, and that they are willing to, to subject even their union interest to the bigger national interest. If they can demonstrate that, to Nigerians, it will be good and it will be better.
Strike action embarked upon by the health workers. Could it also be that they are trying to be at par with the doctors? Of course, the health workers have said, no, that is not the point. All they're asking for is justice and equity, of course, and fairness. But, well, this debate continues, and we'll take a quick break at this point, and when we return, it will be time to coast home. You're still watching The Big Issue. It's indeed a hot and, of course, let me say healthy show, because we're debating issues in the health sector. So I can safely call this a healthy debate. But gentlemen, it's time to have your last take on this subject matter. I will start with you, Comrade Adegoke Kehinde.
Okay.
Your last take in 30 seconds. Okay,
my last take on this big issue today is to use this medium to tell President Muhammadu Buhari that the health sector needs total reform. It needs to put proper professional health administrator to manage the system. That is the international best practices. And I want to promise President Buhari that if he does that, he will not need to travel abroad again for his health care.
I'm not supposed to take sides. I'm not supposed to take sides, but I like that last part. Cyril Abaku, your last take on this subject matter. Let's let him speak, please. All right, Cyril, go ahead.
I would like to think that if you've been doing the same thing for 30 or so odd years, and you've been getting the same results, it is only logical that you rethink your strategy. I am not aware that any particular union or body has achieved everything it has desired to achieve by industrial action. So I would advise Juhesu to go back to the drawing table,
dialogue,
do some soul searching, negotiate, bargain, hold talks, and see how they can resolve.
That is in process already.
But when we resort to industrial actions this way, our conscience is okay with it.
All right, then a round of applause for our debaters. Well, ladies and gentlemen, like General Yakubu Gowon said about the Civil War, no victor, no vanquish. On the big issue, no victor, no vanquish. So we ask both of you to bury your hatchet on the big issue. And come on, let's shake hands. That's the essence of the show. One love. A round of applause for that.
One Nigeria. One Nigeria.
Okay, that's enough. Thank you very much. Well, ladies and gentlemen, thank you very much for watching this episode of The Big Issue. You can, of course, follow me on Twitter. My handle is @Femi Akonde TVC. You can also follow TVC News @TVC News NG and @TVC Connect. Well, until next time, the program has been The Big Issue.